I do have a financial relationship following these companies. Here is the agenda. We have unpublished data studying prevalence of femoroacetabular impingement dysplasia in labral pathology. Between 2009 and 2011, 227 patients underwent hip arthroscopic surgery due to labral pathology. 67% have FAI, and 23% is considered to be the dysplasia of the hip. Background: in the past, hip arthroscopy was not recommended treatment for dysplasias. However, in these decades, there are several studies looking at the improvement clinical outcome and lower reoperation rate in dysplasia hip with labral tears. Despite these successes, Dr. Parvez reported a high reoperation rate in dysplasia hip with labral tears following labral debridement. Moreover, labral debridement in hip with borderline acetabulum coverage had a worse clinical outcome and had high reoperation rate. And Dr. Matsuda reported labral repair and camel osteochondroplasty cannot prevent progression of osteoarthritis. We presented the last ISHA meeting as a clinical outcome following arthroscopic labral repair and camel osteochondroplasty for the dysplasia of the patient. Between 2009 and 2010, 16 of 21 patients with dysplasia were enrolled in these studies. Minimum 2 years follow-up and mean age 33.2. In 12 or 16 patients, their hip pain is associated with various types of physical activities. Result: all patients had labral tears, and 62.5% had cartilage delamination at limb regions, and only 2 patients had advanced cartilage defect at femoral head and acetabulum, and 87.5% the patient had CAM lesion at femoral head neck junctions. And modified Harris hip score significantly improved from 52.2 to 86.8. Here is a case presentation of 21-year-old female rhythmic gymnast with right hip pain for the past 6 months. She used to be a winner of Japan Rhythmic Gymnast for 2 championships for 2 years. She also has a CAM lesion and alpha angle 18 degrees and central edge angle just 10 degrees. She refused rotational acetabular osteotomy and another invasive surgery, so we carried out arthroscopic surgeries. So the labral tear and cartilage delamination Mahon grade 2nd bubble were observed at limb regions. And we made the limb recess elevating with capsule and refresh the limb without limb trimming, and we placed 5 suture anchor with 10 suture for labral repairs, and CAM osteochondroplasty and capsule application were also performed. She completed the rehabilitation protocol for 2 years at 3 months after surgery, and she underwent sports tests, and she returned to pre-injury activity level at 6 months after surgeries without any discomfort. Here the right hip pain was involved, but she didn't feel any pain and discomfort. So the overall evaluation was excellent in 30 patients, and initial arthroscopy failed in 3 patients, 18.5%. In these 3 patients, the CE angle was less than 15 degrees, and the classification of the cartilage delamination and limb lesion was over grade 3rd. The one is converted to THA, another is converted to RAO. And our data shows the high prevalence of CAM impingement in dysplasia of the patient. This slide shows the case presentation. Actually, he is one of my friends, he's orthopedic surgeon and enthusiastic soccer player, but he started to hip arthroscopy, but he just wanted to his hip condition, and he took the X-ray examination, and he realized the central edge angle at 18 degrees and cam region at femoral head and neck junctions. And he also took the 3D CT scan and made the 3D CT scan simulations, and he realized the cam impingement at flexion 70 degrees, abduction 10 degrees, internal rotation 29 degrees at kicking positions. So we believe the dysplasia patient has two mechanisms of level of injuries in it. So dysplasia patient has a high frequency of the cam lesion resulting in dynamic impingement, as well as shallow socket resulting in static overload problems. So this arthroscopic treatment consists of labrum repair and capsular application and cam osteochondroplasty did not solve the underlying mechanical problems. So on the other hand, there are several studies looking at how labrum pathology influences the Chiari and Shelf procedures. So detached acetabular labrum has increased the risk of clinical failure of Chiari pelvic osteotomies. And the Shelf acetabuloplasty long-term clinical outcomes are influenced by the presence of labrum tears. So we devised the new endoscopic technique consists of labrum repair and reconstruction, cam osteochondroplasty, as well as Shelf acetabuloplasty. We introduced a case presentation of 70-year-old long-distance runner with left hip pain for the past 6 months. Central edge angle was 15 degrees, and cam in 3D CT shows cam lesion at femoral head and neck junctions, and MRI shows the labrum tears. We introduced a surgical procedure, the step-up approach. We did the diagnostic arthroscopic intraocular evaluation, and the labrum tear was observed, and the labrum refixation using a suture anchor, and cam osteochondroplasty and capsular application were performed, and we switched the scope to the extracapsular space like this, and shaver and RF flow were utilized for optimal visualization. We realized we can see the reflected head of the rectus femoris like this slide. And then 2.54 millimeter guide wire was placed through the drill guide along with the capsular under intensifiers, and the osteotomy was performed along with the guide wires to make the slot, and harvested the free bone graft from iliac crest and measuring 3.5 centimeter to 22.5 centimeter, and inserted the bone shelf graft into the slot, and bone chips were packed above the bone graft. So this slide shows the preoperative, postoperative at 6 months after surgery X-ray examination, and he returned to pre-injury activity level at 4 months after surgery. Conclusions. Arthroscopic labrum repair, cam osteochondroplasty has a moderate clinical outcome and reoperation rate depending on the acetabular shallowness and cartilage delaminations. The new arthroscopic Shelf acetabuloplasty could address both intra-articular pathology and the underlying mechanical problems. This arthroscopic procedure is less invasive and could be beneficial treatment for the patient with dysplasia. Long-term clinical follow-up should be necessary. Thank you very much for your attention.